its risk to the population can be minimized. But the fact of the matter is that because, as already explained by Dr. Mayor, that we have already seen that we've had one death, and one death, it's just one death too many, of a preventable nature, because this is a disease which further infection and spread can be prevented. So we would want to encourage people, those who may have had contact with the patients who have already been diagnosed, please not to hesitate to come forward for testing, and also to say that for the fact that this is a disease which can be treated, anybody who has any suspicions in terms of how we have mentioned that how this illness presents with skin lesions, painful skin lesions, that if you have any suspicion, any doubt, rather go to the nearest health facility so that it can be tested and this disease can be excluded, so that we can save more lives. So that's really the main message which we want to go out there, that working together we can be able to break the cycle, and actually as WHO would want to eliminate. In terms of, there was a question in terms of the vaccines, the number of vaccine doses. At this stage, we're working on the broad criteria of those at high risk, and as we develop the magnitude, we're hoping that there will be no further presentations of people infected with this Mpox. But as we do the tracing, the criteria has been developed working with NICD and WHO in terms of people at risk. And of course, even when we say, for instance, that people with immune suppression, for instance, not everybody who's HIV positive is immune suppressed. People who are taking their treatment will actually be well protected. So there will be further criteria to narrow down, and as indicated, there is no suggestion that even when we do get the vaccine, there will be a mass vaccination. It will be very highly confined to those highly at risk. So it will be very limited doses. I may not be able to say the actual number at this stage, but those are the details which our team, together with the NICD and WHO, are working on. And those who are at risk, we're hoping that we will be able to acquire the first doses of the vaccination in the matter of days, as the discussions are ongoing. And those who are at high risk, including the health workers, for instance, as we know, one of the patients demised at Tembisa Hospital. Even there, it will not be all the workers at the hospital, but it will be those who would have been exposed in terms of the management of such patients, who would be priority to get those vaccine doses. So I think we can leave it there, ladies and gentlemen. Thank you very much.